We're gonna just go ahead and start this, guys. My name is Allison. For those of you that don't know me, I'm a therapist at Turning Point, and I want to welcome you guys and thank you so much for joining us today. If you have any questions at all, please type them in the Q&A spot, and then at the end, we'll go through the questions and answer them as time permits. Before I turn it over to Lisa, I would like to introduce Turning Point to some of you that may not know too much about us. We are a 501(c), a nonprofit that depends on the community support. And on one of these slides here, I think slide number 2, we have our socially responsible partners. So these are the guys that make this stuff happen, and we want to give a shout out to them and thank them so much because we are so very grateful to them for just supporting us through this time. And now I will go ahead and hand it over to our presenter, Lisa.
All right, well, good morning or almost afternoon to everybody. Today we are going to be talking about weight gain during breast cancer treatment. As you see on this first slide, first of all, I know that a lot of my breast cancer patients, when they first come to see me, and they're like, I thought I was at least going to lose weight with all of this. But the hard facts are that 80% of people that are diagnosed with breast cancer will experience some form of weight gain during the course of their treatment. Okay, so why we're going to just discuss today why this happens and just some pointers of what we can do to get this weight off after the fact, or really help prevent some of it from happening. So just the average weight gain, I'll just tell you right now, can be anywhere from 2 pounds, as little as 2 pounds, up to 18 pounds. And some it can be higher, but that's what the average that they state the average is out there. It's a difficult time, especially with the forms of treatment, the treatment modalities that we have. So we're going to just touch base a little bit on what goes on. Just general overall, we're not just women overall. The average woman without breast cancer gains about 3 pounds during menopause, roughly. Some gain more, some gain less, but the average. The risk of weight gain with menopause is highest in women who were actually a healthy weight throughout their life, and then when they reach menopause, they tend to have the highest amount of weight gain. These are just tidbits of information. So these are women just outside of just us in general and outside of breast cancer diagnosis. There does not seem to be a significant weight gain in women who quit their hormone therapy at time of diagnosis. So, these are like, that's a myth that some people think like, oh my gosh, well, I quit my hormone therapy when I was diagnosed and that contributed to the weight gain or caused my weight gain. And women who become postmenopausal within a year after they are diagnosed with breast cancer are more likely to be the ones that will gain weight. So those were just some tidbits of information. Us as females, period, without any diagnosis of cancer, have that ability or the tendency to put on extra pounds as we go through menopause. And that's a whole nother lecture, a whole nother topic to discuss later. But today we're just going to talk about treatment. The breast cancer weight gain, let me move this here. The breast cancer, the weight gain, the research shows that nearly 2/3 of the women who receive chemotherapy will actually gain weight. So that's a big chunk of the population. Weight gain is dependent on several factors. We're going to hit on those, but the length of your treatment, the type of treatment that you have, and the steroid use. And how much steroids that you're using. The average weight gain while on chemotherapy. All right, so we're just talking, and so those of you who haven't had chemotherapy, this 5 to 6 pounds, but on average, if you do have that chemotherapy. Whereas if we are just those who have surgery, they even say that patients on tamoxifen, just tamoxifen alone without all the treatment prior to they don't have that tendency to gain as much weight as those that actually went through the course of chemoradiation. So why is it that we gain? And we're going to hit mostly on our patients that are undergoing treatment, though I've had clients that DCIS and didn't have to go through any treatment and still gain weight. And the first and foremost, before we hit all the other things, is the diagnosis itself. A lot happens with that diagnosis. We know that. I mean, you guys know that more than I. But sometimes, we find comfort in food. And when we feel that life has thrown us a curveball, we take comfort in food. So comfort foods, we increase our intake. We're depressed, we're sad, and that food tends to help us and comfort us. Because at that point, it's an unknown, an initial diagnosis. We don't know what the next month, next week, next year is going to entail. So we take that and we find comfort in food that we eat, and it's a normal, natural thing to do. So that's one. Sometimes my patients go the opposite way. They are so worried that they stop eating, and too much weight loss prior to the treatment, or too much weight loss prior to surgery, is not a good thing as well. So a lot goes on prior to even starting. But once we start, okay, so chemotherapy itself, we know what chemotherapy is. Chemotherapy is the treatment. It is, intravenous. We inject this chemotherapy most of the time into our system. Some take chemotherapy pills, but chemotherapy, what it does, just the dynamic of it, it causes our body to hold on to extra fluid. You will notice that. You can notice that fluid is called edema. That extra fluid obviously will reflect on the scale. So when we receive chemotherapy, generally our doctor, when we go in every time, we're weighed. The weight gain, we'll talk about the curves, the nadir, the ups and the downs. But basically, we do gain. The chemotherapy can cause that the edema. Chemotherapy causes people to have reduced physical activity. For those of you who have undergone chemo, we understand that. It's usually the fatigue. This fatigue also comes with radiation as well. So that fatigue, and it's a different type of fatigue. It's not a fatigue of like overworking yourself, working in the yard for 5 hours and just like so exhausted and so tired. It's a completely different type of fatigue. So our decreased physical activity. So with that being said, when we decrease our physical activity, obviously we're not burning those extra calories, and then obviously we're retaining that fluid. We can be, but when we decrease that activity, we do have some muscle wasting. We can have muscle wasting, and chemotherapy itself, period, can cause muscle wasting if we're not having our diet appropriate amounts of proteins, carbs, and fat. Mostly protein, our muscles tend to waste. And we know, well, if you don't know, muscle is more metabolically active than our fatty tissue. So if we're losing muscle mass, if we're not more physical active, or if we're more inactive than active, our muscles will atrophy. And so we can be eating the same amount of food that we were prior to and still be gaining weight. And that is because our muscle mass, our lean tissue is less. And so our body is not going to burn as efficiently with what we give it. Okay. Chemotherapy can cause the nausea. And a lot of times when I meet with patients, I talk about things that can help improve what we can eat, that can improve that nausea. And, a lot of the times it's keeping something on our stomach, keeping food in our belly so our body doesn't get over hungry. And in doing that, sometimes we eat too much at those times because the nausea is so profound. So that can contribute to the weight gain. Chemotherapy can cause intense food cravings. Chemotherapy itself we first notice it works on a rapid turnover cells first. So we notice different things like our taste buds. What cells do we turn over rapidly? Our skin, our nails, our hair, all of it in our GI tract. So all of our mouth, all our throat, all of our intestines, those cells turn over rapidly. Those are some of the ones. So we can, especially with chemotherapy, have these intense food cravings and these intense food aversions based on based on our taste buds in our mouth. Um, some taste buds become more hypersensitive. So I get some clients and some patients that say, I can't eat anything sweet. It just nauseates me. That's that sweet, that sweet taste bud that's overacting. Or some people say foods are too salty. I can't do that. Or I get the opposite. Like all I want to do, I crave sweet, I crave salty food. So it is the swing of that pendulum. It can go either way, and our bodies are reacting to what that chemotherapy is doing to those, especially to the cells on our tongue. So those intense food cravings, it's almost like I have a lot of my female clients refer to it as like a pregnancy, like you crave things during your pregnancy, like, cliche pickles. But that is exactly what is relayed to me. That's what the cravings are. So the chemotherapy does decrease your metabolic rate, your metabolism, okay? And your metabolism is the rate that your body burns energy, okay? And during this time, it's almost a catch-22, is because our body actually needs more calories to support what's happening to it, to support the chemo/radiation, to have less muscle wasting, to have less fatigue and tiredness, to have less breakdown. But at the same time, some of these breast cancer chemotherapy drugs can decrease the metabolic rate, and that can contribute directly to the weight gain. With that being said, for those of you that have undergone or currently undergoing chemotherapy, is that we know that we have certain days that are just bad days. We can't eat, we can't keep anything down, and then our body kind of just adjusts to not having what it needs, and it protects it, it saves it. And then we have those really good days that we're feeling great. Better. I don't know if we ever feel great is not the best term to use, but we're feeling better. We can eat more. Our tummies aren't upset. And so we tend to eat more during those times. And during those times, sometimes then we go towards those comforting foods, because this is a very uncomfortable situation. And we, again, like I said earlier, we find a lot of comfort in food. So we'll be going to those foods that comfort us, high calorie foods, macaroni and cheese. I pick on that one a lot, but that food can be both good and bad if in the quantities that we take it in. Another thing that in the chemotherapy can cause some women menopause, chemo-induced menopause, which that also decreases that metabolic rate. Okay, so other things, we have the chemo. If we have clients that just undergo radiation treatment, they don't experience a lot of this. The fatigue is still there, and that the muscle wasting can mostly occur with just the radiation end, if that is what we're going. For those of you that just have surgery, again, that's the same. It can be the same type of a case scenario. After surgery, we're less active. We're not allowed to exercise for a while, and so our muscle mass is wasting. So we look at those types of things once we are or going through or after post treatment. Okay, so this pertains mostly to our chemo patients. You will know, if you've undergone, that we give steroids to our patients to stop inflammation. Okay, it reduces the symptoms of, inflammation, the swelling. We use steroid medications to help combat and treat nausea. And sometimes we use steroids as part of the treatment itself. Okay, so the steroids can contribute to the weight gain by, they increase an appetite. Some people say it's a ferocious appetite, and at that time, it seems like they have a bottomless pit. And these are days, after the treatment, a couple of days, depending on the length of the steroid use, but it's ravenous. That's how it's explained to me. And it's like they eat and eat and eat. And at that time, what's hard is when the food cravings come in, it is hard to combat that. So, when our appetite is, when we're raging, if we can be more mindful of what it is that we're craving, and try to help compensate or help combat that craving. I'm not saying, if we're craving something sweet, have something sweet, but then we have to go away from that. We have to go to something else. If we're gonna, we can make a pact to ourselves. If I'm gonna have this cookie, then next time I'm going to eat this apple with some peanut butter or something, try to have something beneficial in that. But our appetite actually does increase with steroid use. An increase in fatty tissue if we have long-term use of steroids. The steroids do increase fatty tissue, and which can increase the size of like our abdomen, or if you see fullness around the neck and the face, we get more of a moon-shaped exposure, face. I don't even know what the word. Anyway, I went blank. But so more of a moon-shaped face. But we have more of that fatty tissue, and then again, more fatty tissue, less lean tissue. Less lean tissue is more metabolically active. Fatty tissue is not. So we have more fatty tissue, and it's burning calories at a slower rate. So that can contribute. Also, steroid use, the weight and muscle mass loss, called wasting. Okay. The word wasting, sometimes people will think it will envision someone just wasting away, but wasting also refers to muscle mass. So I do have a lot of females that, prior to, and they're like, well, I eat my arms, and now my arms are always wiggly, and that's your wasting. That's your muscle wasting, and that will revert back to what I said as far as our lean tissue. If we don't have as much lean tissue during this time, you're not as metabolically active. All right, so those are the things that steroid, what contributes to this weight gain during this time. All right, the effects of weight gain. I found this to be helpful and interesting. The studies do show that some types of treatments, such as like the Arimidex, are less effective at treating breast cancer in patients who are on the obese end. So we are going to discuss that in a minute. And some evidence suggests that premenopausal women who gain weight have a 1.5-fold increase in cancer recurrence. So it is important that we get this weight managed, but it is very challenging at this time. So what can we do? You'll read a lot. There's a lot out there, and let's just go to the next slide. We're going to talk about that. So now what? Like, what do we do? So we've gained weight during this time. I just gave you why it's not good. Your doctor's probably saying, and you probably read, you need to be in more of an ideal body weight. You need to be there. That's to decrease your chance of recurrence or just cancers in general. So now what? Okay. So the key to this is overall health. Okay. The number on the scale, it is important. I understand that, but that is not the key. The one and only key that will make you successful. All right. I know a lot of us don't like to hear that at this time, but if we become healthier eaters and our body is healthier, it is okay if we have a little bit of extra weight on, depending on our weight distribution, than it is to be your perfect number, that perfect number. So the scale we use all the time to monitor when you come into the clinic, we do that just to make sure you are not falling too far on either end of that spectrum. If you're not gaining too much or losing too much, because both of those are not helpful. So what can we do to be successful? I have a lot of patients after, it's very hard, especially after the treatment, and then we're putting on these hormone, like the tamoxifen, hormone estrogen blockers. So it's hard. But we cannot have the mentality, attitude, well, my doctor says I'm going to gain the weight. So, it is what it is. Not everybody, we said 80% will. So that doesn't mean you necessarily absolutely have to do that. So the first thing I always really love for people to do is keep a food journal. All right. Keeping a food journal, it keeps you accountable. Keeping a food journal will actually maybe really open your eyes to, wow, I'm eating very high calorie foods. Not a lot of them, but a lot of high calorie foods. So it can make you more mindful and more aware. Writing things down will actually help in the weight loss, because I don't know about you, but I would rather forego another brownie than have to write it down and say I ate it. So it keeps us more accountable. Journaling, it doesn't have to be fancy. It can be just like breakfast, I ate this, this, and this. Lunch, this, and this. And this is something that we can go back and look at a later date and see, and see. And you'll notice, even if you journal during your treatment, whether it be the chemo, radiation, the surgery, you'll see that swing. You can see the swing of, you can even watch and see that what you're craving. And with each with each round of chemo, or each, you can actually be craving and wanting just different things, because chemo acts very bizarre that way. Your taste buds will predict. So I always tell people, get a journal, start writing stuff down. That helps us become mindful in the long run. Also, what that is helpful with is if you meet with a dietitian, she can go over that, and she can play with it and tweak it and find better avenues, or maybe make better suggestions of what we can do. Okay. This is a big one. I like this one because people don't think of this as calories sometimes. We have to pay attention to what we're drinking. My favorite is, everyone says, I do these smoothies, and smoothies play a role in sometimes, but if we're thinking that, we're just going to drink these smoothies because they're healthy and they have all this food in it, they can actually be very, very heavy in calories, very heavy. That's the first thing if someone's like, I drink smoothies, and I'm like, what do we put in our smoothie? And if we think about breaking that down, I put a banana, I put an apple, I'll put 2 carrots, I'll put spinach, I'll put these berries. I mean, if we just look on the smoothie, the example here, they put oats in there, which is great, with all these fruits. A serving of fruit is 60 calories. And so if we put in a whole banana, that's 2 servings generally. A banana serving is about 4 inches, about 4 ounces. So that's 120 calories right there in itself. If we're putting in a cup of berries, that's another 60 to 80 calories, closer to 80. If we're putting in the carrot, and then we're adding that, and then we're adding, and then we're adding, and then we're adding protein powders, and we're adding 100 calories here. I've had some females that their smoothie is about 700 or 800 calories. I always prefer us, if you lay all that food out on your table, I'd rather you eat the whole food. Personally, smoothies are great for my head and neck cancer patients when they can't chew and swallow, but those liquid calories like that, sometimes they can bite us in the end. They can get us. Juices, a lot of people are like, they're like, I'm juicing more now, I'm drinking the juice. Juice is very concentrated calories as well. A half a cup of orange juice is 60 calories, whereas an orange is 60 calories. So, if you're drinking 8 ounces to 12 ounces of juice, that's very heavy. I'd rather you eat, the 2 oranges. I know it's not the same, 2 or 3 oranges, and people are like, I could never eat 2 or 3 oranges at a sitting. So just be more mindful of that. If we like that juice, I usually say dilute it down. Start weaning it down, weaning yourself to more diluted. Start off with 8 ounces. Start off with 3/4 of a cup juice and 1/4 of a cup water, and then just keep cutting that back. That's a helpful way to go about doing it. Other things like frivolous fun drinks, we find it harmless to run through Starbucks sometimes. And depending on what you get, it can be as much as 180 calories, or I should say as little, or it could be 0 if we just get black coffee. Or it could be, as high as 4 or 5, 600. Some of those beverages are very, very, very dense in calories. So we need to watch out for that. The great thing with that kind of coffee shop is that those calories are available to you before you order. And that's just calories. We're not talking about anything else, saturated fats or sugars, and which we're going to hit on. So, and even just a simple, innocent, what's my favorite? What's my indulgence is a flat white, and that's whole milk and coffee. So those are calories if we just feel harmlessly going in and consuming. And of course, regular sodas. I mean, there's not a lot of regular soda drinkers out there, but it could be regular soda. It could be sweet tea. Sweet tea can harbor as many calories, if not more, than a soda. So we just are more mindful of what we're putting in. Hydration is important. Crucially important for the radiation, or actually for everybody, just to keep us hydrated. But our fluid intake, we just need to focus on mostly if we can get that in the simple water state. Okay, so pay attention to things that we're drinking. If at that time, during chemo, or, in radiation, we do need more protein as females. I mean, not just females, as a cancer patient's period, we do need some more protein. And, on those hard times when it's, hard to get it in, and we're like, how do I get extra protein? And people will run to Boost or run to the Ensure, and that's fine, but we have to remember the amount of calories. So at that point, we look for a nutritional supplement that has protein, that has a lesser calories, like Ensure Max. If we want that, that's the 30 grams of protein, but it has 150 calories. It's not as high as Boost Plus, that has 350, and 20 grams of protein. So just look around for that. We can buy protein powder if we're needing more protein without all the calories. I generally tend to have my female clients look for more of the lower calorie end of the protein powders. One I love is Unjury protein powder. It's ordered online. It's unjury.com. Unflavored protein powder. That's all that's in it is protein. There's not a lot of added fluff. No added, it only has soy lecithin in it, which is the emulsifier, which is perfectly safe. So that's one that we can take that and we can add it to, and do unsweetened almond milk, a vanilla almond milk, and a scoop of powdered peanut butter, and you have a really great absorbable protein drink. So that's one that I recommend if we need extra protein. Being mindful of our red meat consumption. Okay, red meat, this is nothing really direct. Well, it can play in your weight gain. This is decreasing chance of any further diagnoses, but choosing our meats appropriately, obviously leaner cuts of meat. Red meat, just as a general whole, we shouldn't have more than 18 ounces per week. And red meat is, beef, it's pork, though it's advertised as the other white meat, it is still a red meat. So beef, pork, lamb, venison, veal, anything really that doesn't cluck or swim, basically. So we need to monitor that. And when we do eat our protein, we need to choose the leaner cuts and the leaner cooking methods. Obviously, we know, I shouldn't say that, but we know that a fried chicken is going to have more calories, and it's not necessarily the frying aspect of it, period, but it's the skin, it's the coating. So if you have fried chicken, don't eat the skin. And everyone looks at me like, why would I eat fried chicken? That's the food part of it. So it is monitoring that much, those types of things, those concentrated higher calorie end of all the meats. Increase our fruits and vegetables. I'm sorry, that's a little blurry, but increase. You cannot go wrong. Where we can go down a wrong path is just eating all fruits and lots of fruits, because I had mentioned, a fruit serving is about 60 calories, and that's fine. We should incorporate a serving of fruit with every meal. It's a great carbohydrate. We should get color on our plate. The more color that we have, the more phytonutrients. The phytochemicals are what gives that fruit and vegetable its color, its beautiful color. So the more color that we have, the different vitamin, mineral, and phytonutrient profile that has. So fruit with every meal, but if we're just going to be, eating fruit like it going out of style, my mom would say that, I would eat her cookies going like they're going out of style. But so we have to remember there's 60 calories in a serving of fruit. So what is a serving? I had mentioned before, half a banana, 4 ounces of a banana. An apple, there's an apple on there. An apple is one that's like about the size of a tennis ball. Just the same with an orange, a pear, a peach. That's about, we allow about 60 calories for that. Grapes, there's grapes there. About 16 grapes is what a serving is. Melons and strawberries and berries, about a cup. So a cup of melon cubed, you know, a fourth of a average size cantaloupe, not the ginormous ones, but an average size, like, you know, mush ball. If that's even a thing. So yeah, so that about a fourth of that. So those are 60 calories in itself. Incorporate those with every meal. Vegetables, on the other end, if they're non-starchy, they are relatively very, very low in calories. So that is where, if we have this ravenous appetite, even being on treatment and wanting to fill that tank, you know, fill it more with fiber. Fiber slows down the digestion of our meal. Fiber helps keep us regular, and that's vegetables is a half cup cooked or 1 cup, we say. We allow about 20 calories per that, have a lot less. Some have a little bit more, but on average about 25. So you can eat a whole cup and a half of vegetables for less than 100, or 2 cups of vegetables for 100 calories or less. That's a lot of volume, and that's great. That volume helps fill the tank. So you can't go wrong with increased fruits and vegetables. Okay. We are also going to monitor added sugar. I've covered this in different webinars, but we want to monitor this for 2 reasons. One, if we're struggling with it with weight or gaining weight, sugar is just empty calories. We know that. But sugar doesn't give us anything except enjoyment on our tongue. It's very satisfying. It tastes good. It makes us feel good. But sugar is at the same time just a waste of calories. Sugar is also inflammatory, and we really need to pay attention to these foods that cause inflammation in our body. So let's really be more mindful of the amount of added sugar that we pull in. So on the food label, these new food labels, if you're looking or paying attention to them, you will see under the category of carbohydrates, it will show you total carbohydrates, it'll show you fiber, show you total sugar, and then it'll show you added sugar. And that's what we're talking about, added sugar. I'm not talking about sugar in fruit. I'm talking about sugar that is added to a food. So 6 teaspoons per day for females. If we have any males out there, I apologize, I didn't write. Males are 9 teaspoons in a day. And so when we look at these labels and we're reading a label, it'll show you, say there's 10 grams of added sugar in the cereal that you buy. Okay, so we have 10 grams. What does that mean in the world of teaspoons? So let's convert that number. So we know, I can visualize a teaspoon. I can't visualize a gram. So we take that number, say we have 10 grams of added sugar in our cereal that we just purchased. So you take 10 and you divide it by the number 4, which is now 2.5. And now that tells us there's 2.5 teaspoons of added sugar in that cereal. Okay. So we know that our budget is 6 in a day. So we have to play that game. Like, do I really like the cereal enough to use almost half of my budget to eat that? And I'll monitor the rest of my sugar the rest of the day. If the answer is yes, then so be it. Okay. And that's fine. You have a budget. We don't want you to go over that. Now, you have got a budget. That doesn't mean at the end of the day, if you had your 6 teaspoons, to go out there and start eating teaspoons of sugar. Okay. That does not what that means. 6 teaspoons is the cap. If you don't make it there, you're better off. More power to you. But I put this on here because I don't want people to beat themselves up if they want something that is on the sweeter end. We're going to try to find something with a lower amount of calories, but that sugar, I don't want people to stress over the sugar. So 6 teaspoons is what you're allowed in a day. Okay. Eliminate the saturated fats as much as you possibly can, or decrease, cut back. Saturated fats are the inflammatory ugliness out there. They cause inflammation. So, we know butter, there's in margarine. I put coconut oil on here because, that was our great, huge, posh thing. Everybody put coconut oil and everything, saying it's a better fat. It's still saturated fat. It still causes some inflammation. So let's just be more mindful of where we're getting that. Saturated fat is also listed on the food label underneath total fat. And you'll see it'll say saturated fat and trans fat. So the lowest number that you can get with that, the better off you're going to be as well. I do want to preface that our body does need fat. We do not need to eliminate all fat to zero. Saturated fat to zero would be amazing, but we do need fat to help our body absorb those fat soluble vitamins, vitamin A, D, E, and K. All right, so we do need it. And the other fats are more of our monounsaturated fats, are more anti-inflammatory. So those are better for us. But remember, at the end of the day, they all add those extra calories. They all add extra calories. So, and it's a concentrated form of extra calories. And why it's called fat. Fat in 1 gram of fat, there's 9 calories. In 1 gram of a carbohydrate, there's 4. In 1 gram of a protein, there's only 4 calories. So fat is fat because it's twice as many calories per gram as the other nutrients. Okay. So, what can we do? We can increase physical activity any way, shape, or form. Any way, shape, or form. We know that increased physical activity, it burns extra calories. We understand that. But also increased physical activity is very good for our psyche. It's very good for our health overall in general. It's good for all of our organs. It's good for our blood pressure. It's good for our bones. It's just good, period. I've never, obviously post surgery, you have to wait for your doctor's clearance, but we're not going to go run marathons or do any of that during the course of our treatment. But it is important to stay active even when treatment. Fatigue is high, but research shows that being more physically active, and we're not saying to go run a marathon, but being more physically active during your treatment can actually combat and help decrease your fatigue. So find something, and we have to remember this, especially if we're active prior to treatment, and then during treatment, people will feel like they have been unaccomplished if they didn't, walk 10 miles or do what they did prior to. So we have to cut ourselves a little bit of slack. If we go out there, 10-minute walk or just get fresh air, it does a world of good. Okay, so physical activity. Consider strength building exercises. Now, this is all, we have a lot of, this is all determined, your physical therapist at Turning Point can help you in this area. Your doctors have to release you to do this. These are things that can be beneficial on the back end of everything to help decrease weight gain and to help decrease weight once we are done and through with treatment. But you always have to, with this, talk to your physical therapist there at Turning Point before we start anything, get clearance from your doctor. But why we recommend strength training? Obviously, because as I said, during this treatment, we are more inactive. For chemo with steroids, we can have muscle wasting. We can even have muscle wasting, even if we're just surgery patients, because we can have all this muscle mass prior to any course of the treatment starting, and if we are not still building during this time, we can lose all of our endurance as simple as just 1 week. So strength training, building more muscle. Remember, I said muscle is more metabolically active than fat is. So if we are trying to get weight off, I always encourage my clients, all right, exercise, but at that same time as you're trying to lose, strength train. Okay, females are afraid to strength train sometimes because they're like, muscle weighs more than fat does. That's a fault, because if I had a pound of muscle and a pound of fat right here, they are each a pound. But what is the difference? The muscle is more compact. It takes up less space. It actually looks better on your jeans, looks better. So it takes up less space. So we can have 2 people that weigh 175. One is all fat and one is all muscle, and they're going to look like 2 different people. Okay. And their metabolic rate is going to be different, because this one is going to be able to eat a heck of a lot more just to sustain their body. Okay. So consider strength training. Another thing, Set realistic goals, okay? That I can't stress enough. I always, with my clients, I always work 5% of what your current body weight is should be your first weight loss goal, and then reassess, okay? 5%, some of you don't need to lose 5%. Some of you just need a couple pounds, but if we have chunks of weight to lose or get off, or that's our goal, we need to set those small incremental goals. And 5% of what you currently weigh is where we start. And then you meet that goal, that gives you more traction to go to meet the next goal. So we keep doing increments of 5%. Okay, so realistic, attainable, short-term goals. Oh, shout out to myself. You can meet with the registered dietitian. I do see clients, patients, I should say, via Zoom. They can be scheduled, but if it's not myself, a dietitian can sit and calculate calories, can sit and calculate nutrients for you, your macronutrients distribution, your carbs, proteins, fat. So go to somebody that has credentialing, and try to stay away from Dr. Google and what all Dr. Google is telling you. Seek out a dietitian, and we have one here at Turning Point. All right, one other thing that I wanted to, I think this might be the last slide. I'm not 100%, but I love the American Institute for Cancer Research. If we're at a debacle of like, how do we eat healthier? How do we should be eating? They have a Healthy 10 challenge. It's a 10-week challenge. You can sign up. It's a free program, and week by week they teach you these habits. They bring in they give you the habits. They give you menu ideas. They give you some recipes. So it's a credible source. The American Institute for Cancer Research. You can look at that. It's called the Healthy 10. It's a 10-week challenge. Anyone can give 10 weeks. I mean, a lot of the treatment lasts a lot longer than that. So we can try that. That's a great resource. Okay. And yeah, and that was my last slide. So we can, if Allison, if you want to.
Yeah.
Oh, not Ellis. It's not Allison.
Oh, it's me. It's Allison.
Okay. All right. I see Ellis up there. Okay. I was all confused. All right. So do we have questions?
Yes, we do have one question. One person asked, after chemo, does the wasting go away and metabolism go back?
That's an excellent question. Yes, after chemo, and it's not, we finished chemo on, our last treatment on this Friday. It takes a good bit for the chemotherapy to leave our body, to leave our system. Talk to your doctor about that, because it can be as much as 3 months. But our metabolism doesn't automatically go back. So we have to train it back into where it was. So how do we do that? One, we have to make sure that we're taking the right amount of calories that our body needs. All right. Being overly restrictive and then overly exercising, that affects our metabolism. Over restricting, sometimes, especially post-treatment, our body is still in a flux and it doesn't know. And so it's still holding on to things, and it won't let the weight go. So if we're not eating enough calories, so calories have to be in the right range. Also, eating frequently, fueling that beast frequently throughout the day. So eating breakfast, I always refer to our food as a bonfire. Our breakfast is our bonfire, and that fire is huge and great and roaring, and then the fire dies down. And then, if you think about going by bonfire and throwing just a little bit of leaf or another twig, it spikes it again. So that's our breakfast. That's our little fueling, our little snack. I don't like to say snack. It's a fueling. And then it raises it. And then we have lunch, and it's big again. And then we have our little fueling, and then we have our supper. So the key is how we fuel, what we're fueling with, that's the key, because we want those things to be obviously healthy. We don't want, we can fuel with a Twix candy bar, or we can fuel with, I referred to this apple and peanut butter. I guess I must be craving that today, but so those are the kind of things. So fueling more frequently. Okay, so yeah, you have to kind of reset it yourself.
All right, great.
Okay.
We do have another question now. Any suggestions for what to eat or not to eat for lymphedema?
with lymphedema, what to eat is all this, you should eat all of this, all this that we talked about. What you should watch out really is there's not a link, but I always want to watch the amount of sodium that we take in. Sodium retains fluid. It doesn't retain the lymphedema, the lymph, but it will retain extra fluid, period, throughout the body. So that can exacerbate everything. So watching sodium recommendations, just for us to be, our heart healthy. If we talk about that, I know we're talking all about cancer, but being heart healthy, the new guidelines are really 1,500 milligrams a day if we're over the age of 50, if we have any comorbidities, like if we are overweight, if we're hypertensive, if we're diabetic. So it's 1,500 milligrams. If we're young and in shape and healthy, 24 is about the highest we go. That is not a lot, especially with some of the foods that are out there. Okay, the more processed a food is, the higher the sodium content can be, because the process. That's one thing that I strongly. Making sure that we take it, we're hydrated enough. Okay.
That seems to be all of the questions. Haven't seen any others pop up. So we'll just go ahead and close out. But as you guys know, we can always take questions later on. You can email those to Turning Point at staff@myturningpoint.org. And we want to thank you again, Lisa, for being here with us on this Friday. And thank you so much for everyone that attended today. And as a reminder, this presentation will be posted on our social media pages, YouTube and Facebook. And then we always like to end by saying that Turning Point is committed to the support and recovery of breast cancer patients through the survivorship education. So please feel free to express your appreciation of this complimentary program through a donation at myturningpoint.org. And you can do that now through your PayPal account. So thank you guys so much again. And thank you, Lisa.
You're welcome.
Look forward to next month's talk.
Okay. All right. Bye, everyone. Thanks for
Bye.
joining. Bye.